There are lots of mnemonics that can help you with first aid, and there are two main mnemonics with initial assessment and care. These are the Dr. ABC and also the ABCDs. What we're going to do now is describe both of these. They're designed as a reminder for what to do when you first approach somebody. We'll first look at the Dr. ABCs and then we'll briefly go over the ABCDs because they're very similar. Dr. ABCs start off with D for danger. When you're first approaching an emergency scene, you need to look out for any possible dangers that are going to cause you harm. These could be things like chemicals, glass, slippery floors, or even the person themselves. Anything that's a possible danger. The next thing you need to do is the R, which stands for response. This is where you're going to introduce yourself by saying, "Hello, my name is Keith, I'm a first aider." Or maybe just giving them a tap on the collarbone and saying, "Are you okay?" You're trying to get some kind of response out of them through touch and also sound. Hopefully you'll get a response in this way. If not, the next thing you're going to do, if they're unconscious, is you're going to do the A, and you're going to open their airway, and then B to check to see if they're breathing. To do this, we use the head tilt, chin lift. So you put one hand on their forehead and the other under their chin, tilt the head back to open the airway. What we're doing is drawing the tongue away from the back of their throat to clear their airway. Then we do the B, which is breathing. Place your ear right down over their mouth and you're looking towards the chest and you're able to do a breathing check for 10 seconds. So while you're doing this, you're looking, listening and feeling for signs of breathing. If the person is breathing, then you can stop there and treat accordingly. If they're not breathing, this is where you would do the C, which is CPR or compressions. We'll cover CPR and chest compressions in later videos. The final D is defibrillation. This is where you use an AED, if one's available, to deliver a shock across the chest to hopefully start their heart beating again. The ABCDs work in a similar way. A stands for assess the scene. You're looking for any possible dangers. Also it means apply your barriers to make sure that you've got your gloves on. And A also means airway. Again, head tilt, chin lift. The B part is the breathing check. C will be CPR or chest compressions. Finally, D is defibrillations if you have a defibrillator available. The S's stand for serious bleeding, shock and spinal injury. These are all the life-threatening conditions, and again we'll cover all of these on separate videos. The use of mnemonics can be a useful tool, and it doesn't matter which one you use, or you can use them both, but they're good tools to help you remember what to do in an emergency situation when you're dealing with any patient, whether they're conscious or unconscious.